This is Dr. Daniel Paul, orthopedic doc with Easy Orthopedics, and today we're going to talk about why it takes you months to get in to see the orthopedic surgeon. If you like this video, we put out new content weekly, so please like and subscribe. So, it's not just the orthopedic surgeon, but any specialist like neurologist, rheumatologist, dermatologist. It can take forever. And I've heard of this, not so much in orthopedics, but let's say neurology or rheumatology, people or dermatology waiting for up to a year. So why the heck does it take so long? Well, it's because of health insurance, which sounds bizarre, but just let me walk you through this. So health insurance has so many requirements to get paid. You need to hire a whole bunch of people in order to do it. That's your prior authorization, your coders, your billers. Well, now you got all this overhead, large office to hold all these people, and so you need, you need to pay for that. And how do you do that? You do that by seeing more people. So they end up getting volume overloaded, where essentially they're just filled up to the gills with patients. So, and again, these visits are getting shorter, and I think they're losing quality when they do that. And it's just like a self-serving cycle, or like a vicious cycle where like insurance doesn't want to pay, so you have to. So not only your reimbursement's lower, you need to hire more people. Okay, well now you got to pay for all that, so you got to see more people, but insurance isn't paying, and so on and so on. And it creates this vicious cycle of just like extremely volume overloaded practices, where visits are short. Maybe you're seeing the mid-level, and that's why the wait is so long. However, if you get rid of all that and you go to cash pay, or you don't use your insurance, and you find docs who do that, the wait's usually very short and the visits are usually much longer. So that's it in a nutshell. It's not a good system that we have. It's pretty bad. It's insurance and health systems have really forced it to be as it is, and I hate it and I don't participate in it. But the short answer to your question is, why does it take so long? Because insurance essentially forced volume overloaded practices. So, and again, these visits aren't necessarily like saving time, right? Like they're shorter, so you're seeing more people, but maybe if you have pain in 4 areas, you got to go back to them 4 separate times, as opposed to a longer visit, which could take care of it all at once. So they seem like efficient visits, and sometimes they are, but for multiply injured people, it's probably a pretty inefficient way to get treatment. So again, I hope I was able to answer all your questions. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any specific medical advice, because this video and all my videos are for educational purposes only. Thanks for watching.